at the intersection of health and care. Where the needs of patients are met with compassion are providers like you, empowered with the tools to work smarter and more efficiently. Our patients want easy access and more control, and you need information at your fingertips in a streamlined workflow. Technology is enabling the promise of tomorrow's healthcare today. Take, for example, Taylor. He injured his knee at practice, and the trainer thinks it might be serious.
Yeah, could be strained or torn even. Think you should see an ortho specialist.
Taylor is able to start the process right there. Later at home, he can complete all the forms and insurance info and schedule the appointment. That means the office can verify everything before the appointment. No confusion or calls to the insurance company. He also gets text reminders and appointment information, and even knows ahead of time what his out-of-pocket costs will be, and later can pay online. And the practice ensures a clean claims process up front. At the same time, Evelyn is also scheduling an appointment in the same convenient way. But her situation is different. She's not sleeping well and has been struggling with worsening depression. In Evelyn's case, causality is much less clear to her therapist as he reviews the intake information in advance. He sees that Evelyn might again meet the criteria for a diagnosis of major depression and may benefit from medication, but he is also concerned other factors might be at play.
Well, let me ask, how long has it been since you had a physical or a mammogram?
Well, not too long, you know.
He suspects that, like many patients struggling with depression, she's not been taking very good care of herself. The next day, Taylor sees the specialist, who examines his knee. During the visit, the physician is able to give him her undivided attention because she's able to document the visit and order imaging using her mobile. Taylor feels more at ease and comfortable asking more questions.
So let's get some x-rays and an MRI.
So usually, how long until I can play again?
At Evelyn's visit, with HIE and claims data visible in the EHR, a full and accurate picture of Evelyn's medical history, risk scores, and gaps in care is right in the therapist's workflow. He notes that she hasn't had a well woman visit in 5 years, and there's no evidence that she has had a mammogram or seen the dentist in quite a while either. He also learns that she was earlier diagnosed with hypertension, potentially a side effect of long-term psychiatric medications.
Yes, but I think Evelyn's going to need some additional help and a full care plan.
A proactive care plan requires providers in all specialties to have a view of all the care a patient has received, as well as any gaps. That means better patient outcomes and higher quality scores for the practice. Evelyn's therapist has all the information necessary to refer her to a psychiatrist for a medication consult, as well as to her primary care physician for additional assessment of her long-standing hypertension. At the same time, Taylor starts a virtual visit with his specialist. He can get the results and treatment options without another office visit. She's seen the imaging, and yes, unfortunately, he has a torn ACL, and she's recommending surgery.
And you'll need to start rehab immediately.
And in Evelyn's case, recommendations from the therapist are transitioned smoothly to a care coordinator who can outline a complete plan for her going forward. Primary care, a case management program, mammogram, dental, and even nutrition services with an outside community agency. The care coordinator contacts Evelyn, either by phone, video, or text, and provides her with a case manager who can meet her weekly at her home to support both medication and diet adherence, as well as skill building to manage her depression, ensuring Evelyn can be an active partner in her recovery.
Hi, you must be Lance.
Meanwhile, Taylor goes into surgery at an ASC, and even before he leaves, the specialist has initiated a referral for physical therapy, which the nurse immediately processes, setting into motion the best post-op outcome. Taylor and Evelyn had different kinds of health challenges, but one thing they shared was a process that was responsive and easy to use, and put them more in control of their own healthcare journey. And for you, their providers, it afforded more time with patients and improved the quality of care. Better outcomes, streamlined operations, improved financials, more engaged healthcare teams, and a better work-life balance, with the time to enjoy what you've worked so hard for. not to mention healthier communities for all. That's better healthcare. NextGen Healthcare. Believe in better.